Yeah. So, Mrs. Stead, do you want to just tell me what your journey has been like as regards your hip, all the way through from when you first started having problems?
Yes, probably about a year before the surgery, I started to have pain down the front of both legs, and a little bit of backache, and didn't know what it was at all, so just carried on until eventually, after about another 6 months, it definitely began to be difficult to walk, and in fact I then started to limp on the bad hip side, which I realised, and I couldn't walk very well at all, and was in a lot of pain. Didn't want to keep taking painkillers, thought I've got to find out what's going on, and so I made the appointment with yourself.
How did your pain start to interfere with your lifestyle?
Well, in lots of ways. Obviously mainly walking anywhere, because I was in pain all the time doing that, and I couldn't go a walk, which is something I'd like to do. Even a short walk was difficult. It was there straight away, the pain.
And how old were you at the time?
Coming up to 70.
Right, so you'd retired.
Yeah.
And presumably you're wanting to enjoy a healthy retirement with your husband and be able to go on holiday, attend events, socialise, walk, and generally make the most of retirement.
That's right, yeah. Okay. And it was becoming more and more difficult. And when you feel pain all the time, it's also debilitating in itself to feel like that, yes.
I think a lot of people now, because people are retiring, they're starting to see retirement now, not only as simply an end of time, so to speak, but people are actually wanting to retire and see that as an opportunity to do what they've never really had the opportunity to do. For example, travel, see family, visit family in the States or Australia, go on cruises, and simply make the most of life.
Yeah, exactly.
And orthopaedics is very useful for that, because people can present with advanced arthritis of the hip or the knee, they can't walk, they're getting pain in the groin, pain in the back, pain in the knees, and it really starts to disable them. And I think when people actually come along and realise what can be achieved with a hip or knee replacement, it can be a life-transforming procedure.
Absolutely, yeah. I found when I spoke to people, there are a lot of people who, and I think through ignorance, have no idea what the operation will entail or what it can do for them, and therefore stay away from it, which is, in my case, because mine's been brilliant, it's a very bad thing because it gives you your life back. Exactly.
That's interesting. How did you find the whole experience? Coming into hospital, going through the surgery, the recovery?
I found it all very positive. Yes, I was admitted to hospital the day of the operation and stayed in for just 2 nights and then went home. It was fine in hospital. Obviously, you're getting over a major operation. There was a fair bit of pain and painkillers given, but I ate some food and managed to actually walk a little bit before I came out, and walk up a little step as well. And then I was discharged. And
did you find that the gnawing pain in the groin just disappeared instantly after the hip replacement?
To be honest, I'd not had much of the pain in the groin. It had been the legs and my back.
Right.
But yes. Okay. That all disappeared. I need to say the first couple of weeks are difficult in that there's a lot of discomfort, and you do need to take, I think, regular medication just to ease that discomfort. But very quickly, within, I'd say, 4 weeks, I wasn't using crutches or a walking frame. Certainly in the house, I had a stick for a little while.
But you clearly made a very quick recovery.
Yeah, I was very determined, and if I emphasise anything, it's physiotherapy. I attended all the appointments. I mean, I think that you're the person who puts the new joint in place, but the patient is the one who just has to work.
And that's entirely correct.
Yeah.
My side of it is simply the carpentry.
Yeah.
We do the joinery aspect, but the majority of the patient journey relies upon people following the exercise protocol, getting themselves into tip-top shape prior to the surgery, what we call the prehab, and then doing the rehab with the physiotherapists.
Yeah.
It's very much a multidisciplinary team approach to having joint replacement surgery, either for the knees or for the hip. And I cannot stress the importance of doing all the exercises after the operation. And you are clearly testimony to what can be achieved if you work very hard and do exactly what you need to do.
I think possibly it's off-putting because, to be honest, the first couple of weeks, the exercises, which I did every single day, are challenging, but very quickly they become easier. And I could honestly say I could see a difference in my mobility every day. It got easier and easier. And
how many months down the line are you now?
It's just about 8 months now.
And are you happy with things? Do you feel like you've had your life back?
Yes, I'm unaware. The hip is like it was before anything ever happened, so I'm unaware of it, really, And
what does Mr Stead think about everything?
Yes, he helped with the white stockings and was very good at the beginning. You do need, a couple of weeks of support and looking after when you're not very mobile and you have to be careful.
I think what we tell a lot of patients is it's very important that you make sure you do have family support in place. A lot of patients have family who don't live nearby. They might have a daughter who lives in London, for example, and we try and coordinate admission so it fits in with the family. For example, you might have grandchildren on the way, you might have family weddings coming up, you might be in the process of moving house. And what we tend to emphasise is that everyone gets everything organised to start with. So you plan the house bits and pieces, you organise life, you make sure family are able to attend, we can arrange surgery at the right time to make sure that it dovetails and fits around all your various commitments. Have you managed to get a holiday in since you've had it done now?
It was about 10 weeks after the operation. We actually went to Scotland.
Very good.
We didn't do a lot of walking, but we visited places, and it was fine.
Excellent. And you've just come back from Lincoln as well.
Yeah, Lincoln and Canterbury. So
did you manage to do Steep Street there?
We did Steep Street, yes.
Which is quite impressive after a hip replacement.
No sort of, no effects really. No.
Well, I'm absolutely delighted for you. You've clearly worked very hard. All your hard work has paid huge dividends, and I'm absolutely delighted for you.
And I'm still doing the exercises. They now don't take very long anyway because they're easy to do. But I do them because I'm very aware it's still a new joint and I've got to keep the work up on it.
Well, I think Mrs Stead has pretty much summarised there what can be achieved after a hip replacement. She's set out in detail what the patient journey is like and the importance of doing both the prehab and the rehabilitation after a surgery. And she's clearly testimony to what can be achieved when a person really focuses on doing their exercises and gets themselves into tip-top shape after the surgery. And I'm delighted for her.
And thank you for literally changing my life.
A pleasure. Thank you.